welcome to the Ask Dr. Rita show. My name is Dr. Rita Jabin and I welcome you to this live show. Today is a different program because I'm going to be teaching you. I want you to drop your questions and I'm going to take all your questions next week, Tuesday. Today, I'm going to be talking to you about liver cirrhosis. Yes, I'm talking to you about liver cirrhosis because it's something that you need to know and you need to know how to protect your liver. What is liver cirrhosis? Liver cirrhosis actually is a progressive liver problem. It is actually the fourth or the third stage or the fourth stage in a liver problem. Normal healthy liver should not have an inflammation. I think there's a image showing on the screen right now that is showing you different stages of liver. So the liver normally by itself is healthy, is fine, and then from there you find the liver that is fatty, which has to do with accumulation of fat in the liver, and then that fatty liver becomes fibrosis. Then from fibrosis it becomes cirrhosis. So that's like the fourth stage of a liver problem. Now, what are the things? So that I'm just telling you that liver cirrhosis is usually the fourth stage. So it's a liver inflammation that has gone on for long, a liver infection that has gone on for long, a liver problem that has gone on for long. So it has gone from one stage to another stage to another stage to another stage. Now, this inflammation of the liver causes the liver cells to degenerate. The organ, the liver, incidentally, is an organ that has the ability to regenerate itself. But when the progression of the disease moves beyond some stages, it begins to cause irreversible damages on the liver cell. Because before it becomes irreversible, the normal cells that regenerate becomes fibrotic. Fibrotic, having scars, something like a scar, something like a thicker tissue because of injury, because of repairing itself, and the injury is still persistent, so it becomes thickened, it becomes like a scar, and those places that have scar are not able to regrow back again, so that is it, and this now disrupts the normal liver function. Now, what are the things that can cause liver cirrhosis? Things that can cause liver cirrhosis this is not all, but these are some of them. It can be as a result of obesity. When you are too fat, when your BMI is too much, as a result of wrong eating, this begins to affect the functioning of the liver, and because of course there will be fatty liver. Too much of the fat becomes fibrotic, then from there it becomes a cirrhosis and then becomes end stage. Could even result into cancer. Also, complications of diabetes. Complications of diabetes, long-term diabetes, uncontrolled diabetes can affect your liver and cause liver cirrhosis. Then alcoholism, too much alcohol consumption, and maybe not even too much alcohol, maybe not too much in the sense that the person becomes drunk, the person is, no, it's just that steady, normal quantity of alcohol you take over a period of time. For instance, you are a social drinker, you drink like 2 or 3 bottles of alcohol in a week. If you add a week to a month, to 6 months, to 10 months, to 1 year, to 5 years, to 10 years, the accumulative effect of this alcohol in your body causes the liver to become fatty, or in some cases just become fibrotic, and then from there progresses to liver cirrhosis. But one thing I need to let you understand is that nobody starts out as liver cirrhosis. No, it goes from healthy to stage 1 unhealthy, to stage 2 unhealthy, to stage 3 unhealthy, to stage 4, which becomes, so it's liver cirrhosis is actually a progression of the disease. Also, it could be as a result of allergic reactions. Some autoimmune disorders can affect the liver cells. That's why you need to be careful about the things you take. You need to be careful. You can't just eat anything. You must know the thing that you're allergic to. Also, it could be as a result of chronic hepatitis, especially hepatitis C, hepatitis D, hepatitis B. Chronic hepatitis can lead to that. When there's a problem with the bile duct or a problem with the gallbladder, but particularly a problem with the bile duct can lead to cirrhosis of the liver. And then you have bacterial infections or viral infections. These can cause this. Now, what are the symptoms of liver cirrhosis? This may not be only it, but of course, there's cirrhosis. It could lead to, you can have problem with your blood capillaries, just to find out the person is bleeding unnecessarily or bleeding so much. Also, there's fatigue, there's insomnia, there's itching, there's loss of appetite, there's sudden loss of weight. The person is just losing weight. There's nausea, there's pain in the upper right region, there's weakness, there's confusion, there's headaches, there's swollenness of the legs and hands, there's loss of air, there's jaundice, when then there's frequent episodes of fever. Frequent, you are treating fever too often. If you notice that you're always treating fever, please quickly go and check your liver, because all those recurring signs of fever, today you are feeling feverishness, before you finish, as you're finishing the course of the therapy, you are noticing that the fever is back again or the symptoms are back again. It's time for you to check. There is a shortness of breath, your urine becomes dark, your stool is also black and tarry stool, you are vomiting, you are all of a sudden you're walking, you are staggering, you are some point itself, the person may be experiencing confusion. These are some of the signs of liver cirrhosis that you don't want to play with. Now, what are the tests that someone can do? You can do a liver function test. A liver function test will usually show you the liver enzymes, you show your bilirubin, you show your AST, you show, these are some of the enzymes of the liver. It will show it to you. Now, it will tell you if there's a liver cirrhosis already. In liver cirrhosis, there's already a disruption in the functioning of the liver. So the liver enzymes would indicate to you that there's a disruption. Now, if you are having abnormal levels of liver enzymes and you're not doing anything about it, you're not doing yourself any good, and it's not something you should be looking for, something to take and Google. I always say that liver is not that organ you just want to self-treat. It's better you treat yourself properly. Go see, book a consultation session. You can book a consultation session with me. Talk to your doctor. Let them do proper analysis. Let them do proper. Don't self-diagnose yourself for liver cirrhosis. So you want to do a consultation first, and then you want to do tests. You can be sent to do your blood test. One of the other tests, apart from liver function test, that you can be asked to do in accompanying with your liver function test is a lipid profile test, to check your blood cholesterol levels. And it's advisable that don't just go do total cholesterol, do the total full lipid profile test. All the lipid in your body, every of the type of lipid in your body, check, and you have found out that, oh, you are experiencing these things. What should you do? I want to tell you that, look, it's not something that you need to treat yourself for. It's not something that you need to try and self-diagnose, but it's something you need to act very fast on, because we want to. One of the things that the consultation in case of liver cirrhosis is designed to find out is this condition. What for someone that their cirrhosis came as a result of too much alcohol consumption, the approach really, if you're going through natural therapy, if I'm treating the person, is different from someone who is diabetic or who came as a result of viral or bacterial infection. So the trigger is what you want to identify, and that's one of the important things that consultation will do for you before your treatment. Anyway, thank you for joining me. I'd like to know, where are you joining from? Can you drop it in the comment section? I'd like to know, are you watching me from? Put it there. Do you have questions? So back to my talk on liver cirrhosis. Now, for someone that is not already having this and wants to prevent liver cirrhosis or wants to care for their liver, one of the things I'm going to say to you is this: one way that you want to care for your liver, one important thing that you need to do is reduce the amount of chemical drugs that you take. Yes, reduce the amount of chemical drugs you take. The more drugs you take, the more work it gives, because one of the key functions of your liver, I didn't remember to mention some of the functions of the liver. One of the key functions of the liver for you is that it does the work of detoxification, it does the work of purification, it does the work of fighting infection. Part of the work that your liver does is that it produces cholesterol. It also helps to do that, and then it also help the body to produce or to store bile that is produced by the gallbladder, So these functions are very, very important. And the amount of the quantity or the amount of external things that you take in your food, like in your drugs that you take, supplements that you take, the more of all these things that you need to take, the more work that you give to your liver. So what's the best thing you want to take? You want to make sure that you are well hydrated. You want to make sure that you're eating well, because if you're not eating well, your body would have to produce cholesterol. So you have people with who say that, I'm 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 having I'm not eating, I'm trying to manage my cholesterol, so I'm not taking oil, I'm not eating this, I'm not eating that. When they go and do tests, cholesterol is still high. Why? Because the body will produce. So in caring for your liver, one thing that you must put is balance. You must put balance. Balance is very important, and balance is required. You must be able to balance things. You must be able to balance yourself. You must be able to balance what you eat. You must have time to sleep and stay away from chemical drugs. Stay away from artificial things. And some of all of you that are trying to, you want to be yellow by Christmas, you want to lose so much weight, so you are drinking this, drinking that. Be careful. Be very careful. And I want to end by saying to you that one man's food is really another man's poison. You don't know what you're allergic to, and you don't know how your body will react to something. So be very careful how you go about some of all these things you are taking. Anyway, my name is Dr. Rita, and I hope you have learned a lot from me today as I talk to you about liver cirrhosis. It is not a death sentence. Liver problem is not a death sentence. The liver has the ability to regenerate itself if we take actions on time. If you are dealing with a liver problem, please call the number on the screen now and get in touch with me. And for the month of November and December, I'm offering you a combo with 95,000 naira. You're going to get a 30 minutes consultation session with me. You're going to get a 6 weeks treatment. And you're going to get a list of what to eat and what to avoid in case of your liver. Take advantage of this. Don't miss it. Care for your liver. If you know you've been on drugs all year, you've been taking alcohol, please care for your liver by taking a decision now and take a decision today. I'll see you next week Tuesday as I talk to you on impact of diabetes on your liver. I'll see you next week. Have a good evening. Bye.